Good morning, good afternoon, everyone. It's a pleasure to be here today to present our study on boundary supervised transUnet. My work focuses on a critical application of deep learning, improving the segmentation of brain tumors in MRI scans with a specific focus on solving the problem in accurate boundary delineation. The motivation for this work is strictly clinical. Gliomas are aggressive tumors with a median survival rate of only 15 months. Radiologists rely on MRI for diagnosis, but manual segmentation is slow and has a high error rate, up to 20% variability between doctors. Current automated solutions, like the standard unit, face a technical gap. While they are good at finding large regions, they struggle with two things. First one is small, low contrast regions, specifically enhancing tumor. And the second is global context because the standard CNNs have a limited field of view. Before diving into the model, let's look at the data. We utilized the BRATIES 2021 benchmark dataset, which is unique because it provides for distinct MRI modalities for every patient's volume. T1 and T1 weighted provides clear anatomical structure with high brain tissue contrast. T1C, T1 with contrast, highlighted actively enhancing tumor regions after contrast injection. T2 weighted shows fluid filled and abnormal tissue regions with bright intensities. FLAIR suppresses normal CSF fluid to make edema and infiltrative tumor areas more visible. Along with these four inputs, we have the target label mask that our model learns to predict. Each of these 3D volumes is massive with a spatial dimension of 240 by 240 by 155 voxels or slices. We process these multimodal inputs to capture complementary features of the tumor anatomy. Data visualization. Here you can see the segmentation targets. The masks I'm training the model to predict. We classify every voxel into four classes. Class 0, healthy background tissue. Class 1, non-enhancing tumor. Class 2, edema, the swelling. Class 3, enhancing tumor. Now, I will discuss my proposed topic of research combining the hybrid architecture with boundary-aware supervision. The transUnet architecture. I implemented transUnet architecture. This is a hybrid model that combines two powerful deep learning paradigms. On the left side of the picture, as shown as A, we have the CNN encoder based on UNet. This extracts high-resolution local features, which are necessary for seeing fine textures. In the middle of the picture, as shown as B, I integrated the transform module. Unlike CNNs, transforms use self-attention to model long-range dependencies. This allows the network to understand the global context, essentially understanding where the tumor is relative to the entire brain structure. On the right side of the picture, as shown as C, I implemented the boundary aware loss function to address tissue of the blurred or inaccurate boundaries of small and low contrast enhancing tumors. The key part of this approach is the combined dyes, cross entropy, and boundary aware losses. However, a better architecture wasn't enough. Standard loss functions like dice loss treat all pixels equally. They don't care if the boundaries are slightly blurry. To fix this, I introduced a boundary-aware loss function. I combined dice and cross entropy loss with a specific boundary loss term, weighted at gamma 0.1. This term acts as a differentiable surrogate for the BF1 metric. It explicitly penalizes the model when the predicted boundary does not align with the ground truth margin, forcing the model to sharpen its edges. For my experimental setup, I used the BRA-TS 2021 dataset with a 70-30 training validation split. The implementation was done in the PyTorch on an NVIDIA Tesla P100 GPU with 16 GB of VRAM. I used the ADAM V optimizer with a learning rate of 0.003. My primary evaluation metric was a dice coefficient, calculated separately for the enhancing tumor, tumor core, and whole tumor. Results. These graphs represent the training curves for the both simple loss combination, dice and cross entropy, and extended combination that includes boundary loss. Although both training runs converge quickly, the two loss setup typically shows lower overall loss values compared to the three loss setup. This difference occurs because adding the boundary loss introduces an additional optimization objective, increasing the total loss magnitude even when the model is improving. Despite the higher loss magnitude, the actual segmentation performance improved where it matters. When looking at Table 2, my model BS transUnet bottom row achieved higher dice scores for the necrotic core and enhancing tumor compared to the baseline. This confirms that the added supervision helped the model capture fine structural details that the baseline unit missed. Let's move to the qualitative results. The left side, the grounded truth level. The middle, the baseline prediction. Right, my BS transUnet prediction. In this first example, notice the overall shape. The baseline model in the middle creates a somewhat blobby prediction, whereas my model on the right captures the nonce of the shape more accurately. In the second example, as we can see, the BS transUnet model produces sharper boundaries and significantly fewer fast segmentation compared to the baseline model. In this example, most predictions from the baseline model appear similar, but with BS transUnet, we can clearly see sharper edges and more refined boundaries in the region. Finally, in this example, observe the fine details at the periphery of the tumor. The baseline model smooths over these details, effectively ignoring the exact margin. The boundary supervised model preserves these jagged edges, which is the critical for surgical planning where every millimeter counts. To summarize the visual impact of my work, sharper boundaries. The additional boundary loss successfully eliminated the blurry edges common in the standard models. Consistency, we observed significantly less fragmentation and fewer false positives. The model produced segmentation that are more anatomically consistent with the ground truth. In conclusion, this project demonstrated the integrating explicit boundary supervision into hybrid transUnet architecture yields superior segmentation performance. I achieved this without increasing the model size, but rather by optimizing the retraining objective. For future work, I plan to validate these results using distance-based metrics like Hausdorff distance. I aim to extend this architecture to fully 3D volumetric prediction, currently slice by slice. I also want to explore adaptive weighting, where the model dynamically adjusts the importance of the boundary loss during training. These are the references we use in my research. This concludes my presentation. I would like to thank you, Professor Sang-Suk, for this support and guidance. Thank you for attention. Enjoy your day.